opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our number is 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today I am excited to introduce everybody to Miss Kristen Beauchesne, who is at I'll give you her number, 561-797-4055. It is Daisy Holistic Care right here in Palm Beach County. And her website is www.daisyholisticcare.com. And her email is Kristen, Kristen, at daisyholisticcare.com. Welcome to the show, Miss Kristen. Hi.
Thank you. Glad to be here. Hi.
Thank you so much for taking time out of your busy schedule and joining us today. We appreciate that.
Thank you for having me.
Of course. So, Kristen, can you give us a little background about your history? You know, where did you go to school? What made you decide that you wanted to go into healthcare, and just a little bit about your studies and whatnot?
Sure. I got into healthcare years ago in 1998, actually, when I became a massage therapist, a licensed massage therapist. And I was going to become a doula, a midwife, and went to nursing school, and then fell in love with educating patients and decided to go back to become a family nurse practitioner. And I was a nurse for 5 years on the floor at Jupiter Medical Center, an inpatient surgical floor, and I've been a family nurse practitioner for a little over 12 years, seeing patients 2 years old and up. And across the lifespan, I've seen families, trying to keep them out of the hospital. That's what I learned as a nurse, just try to keep a lot of people out of the hospital. So I have a traditional primary care practice that I launched at the end of last year. It's a mobile practice, so I go to people's homes, and I also do virtual visits. I go from Jupiter to Boca Raton for traveling, but see patients throughout the whole entire state virtually. What brought me to starting my practice was working in family practice and primary care and all the restrictions that get put on being able to treat patients for what they came to see you for. You know, you're limited time, 15, 20 minutes a patient at that. You have to treat the insurance companies before treating the patients a lot of times, and have to fight to get labs approved and imagery approved and get medications approved for them. And so I started this so I could have more time with the patients. They can tell me everything that's going on with them, so we can try to find root cause of things and work on things one thing at a time or all at once, see how they all connect, and overall help people feel better and help them help themselves as well. I don't take insurance for my services.
Okay.
I charge a monthly membership fee, and I have 4 different tiers, but I also have hybrid models for families and non-member fees as well if somebody needs like a one-time visit. But if people do have insurance, they can use it for blood work that I order, imagery I order, medications I order, any kind of referrals. They can use their health savings accounts, cards,
Nice.
things like that.
So It seems to be trending. I've interviewed a couple of other people that are also doing the same style, full service house call family medicine, and just bringing that to the community. I feel like it's trending because it's in demand. People, I believe people as a patient, I would say I would prefer someone coming to my house as opposed to me, waiting in an office and then paperwork and all that goes, all the rigmarole that one has to go through with what it entails going to a doctor's office. And so now you coming to see the patient, it just changes the whole dynamic of it. And you get to see how they live. You get to see other factors that may be involved. How does that support you as a healthcare provider to go in and see a person at their home?
Support me professionally?
Yeah, like as far as your analysis and your ability to see how the patient is living, maybe if they need extra help, or maybe if you see that their lifestyle is not what you would consider healthy. Does it support you in making recommendations as far as seeing them in there?
And I can totally make assessments while I'm there, and suggestions, especially with the elder community. It's good to see all of their pill bottles that they've had. And sometimes they don't like to throw things away, so we consolidate or get rid of old medications. It definitely helps to look to see if there's throw rugs, if there's any fall risks. If there's, I can also assess to see if they need grab bars, if they do need additional help in home, and make those recommendations. Absolutely. And also it does help with discussing diet and hydration and all of that, to make sure that everything's covered.
Mm-hmm.
So yeah, it definitely can help in that aspect a lot.
Yeah, I think a healthcare provider going into the home, it would give you a bigger picture of exactly what's going on. So I would imagine it would support in the total assessment of the well-being and plan for the patient.
For that, it helps. It also helps just time-wise, just to be able to sit down and focus just on the patient. There's no additional noise or anything from an office or getting interrupted or having the visit cut short for any reason. And so that's been the biggest benefit, is that people are comfortable and you get to go through the full history. You get to see the whole picture, to see everything that needs to be helped. And it's nice because you have the visits and with the packages you have however many visits, but also people have concierge care that they can call, text, email at any time as well if they need something additional.
I was going to ask you, Kristen, how does it work? Let's say they just need a telemedicine conversation. Are you able to do that? Go on a Zoom? Okay.
So if it's a one-time visit, I do have one-time visits. I was trying to look for earbuds. I don't know if there's a delay for you. Is it going to be better if I have something?
Oh, no, I think it's fine. It's fine. Yeah. Uh-huh.
So yes. So I use Athena as my electronic medical record system, and my telemed platform is all within that. And so if a patient wanted to see me for one time, I still have a certain amount of paperwork that I would need signed consent-wise, and for them to just acknowledge everything with the practice. But yeah, I could see people just virtually one time, or I have a package that's just all virtual. I have a lot of people that travel, and I can see them in person when they're in town, but when they're on business and they need a visit, it makes it very accessible.
So can you explain a little bit more about your memberships and pricing, and what would that cover?
Sure. Well, again, I have 4 different tiers. My lowest tier is $100 a month, and it's got an enrollment fee as well, like $150. My highest plan is $450 a month, and that has a $600 enrollment fee. The difference in the plans are how many visits you get and what type of visits. So that first plan is just telehealth visits. There's 12 of them. You can add on a home visit for $120. And after that one home visit, if you add that on, you can convert 3 of your telehealths to equal 1 if you need more visits. The next plan, which is $200 a month, has a $250 enrollment fee that has 4 house visits, 8 telehealths. Again, you can convert those if you need more home time. I have 2 rechecks, and that's in-home telehealth. Because, sometimes you might need to see somebody for 6 things, but other times it might just be a sinus infection, and you just want your ears rechecked, and that's it. So that quick recheck, you have 2 of those in there too. And that includes point-of-care services. And the Garnet plan is $350 a month with a $450 enrollment fee. And that includes... that's the 16 plan. 16 visits altogether. And the Sapphire plan has 20 visits, and each of those have free checks and include all point of care testing. So that if you need a urine dip, if you need an AccuCheck, your blood sugar checked, if you need a strep test, a COVID test, a flu test, all of the tests, that includes everything I bring to your house to test. You don't have to pay extra for that, anything that you need. And also both of those plans include blood work. The Garnet plan includes me taking care of the blood work, a full panel, including a PSA, an A1C, and vitamin B12 and vitamin D. And the Sapphire plan includes me covering the lab work twice a year.
Nice. And so you're able to do that blood work when you go to how does that work? When you go to the patient's house?
I don't draw them.
They go to a lab.
Quest, or I can set up for the Quest Mobile to come to the home. That would be an additional charge through Quest, or through Rupa Labs, which could be pretty much, there's a number of phlebotomists that are in everyone's area, and I can have them come to the house and draw the blood work as well. And in the Sapphire plan, people also get access to massage therapy visits and stretch visits that they can add on for additional fees.
Nice. And so when you said a certain number of appointments that include each plan, is that in a year, or is that in a certain designated amount of time? Or just...
It's within a year. The plans are month to month. So it's within a year, and everybody can't use all of their visits all within a month. So it's depending on which plan is how many you can use per month, like 2 to 4 for the later plans, 4 per month.
I'd like to get an idea what type of people are using your services. I'm imagining busy professionals, or maybe I'm wrong, but can you give me an idea of the type of people that are using your services?
Honestly, I've had a little bit of everyone so far. I've had families which love the fact, especially if somebody has a toddler, 3, 4, or 5 years old, and it's hard for them to leave the house and to go and sit in an office. So to see the whole family, it makes it so much easier to take care of everyone. And again, having that text, email, call real quick too, if somebody forgot something or if they just need something really quick, it's been nice. The elderly population, this has been great for them because, especially if they're not very mobile and they're tired of going to the doctor's office and just sitting there waiting, and they only get 15 minutes, and they're 90 years old. So they have this list of comorbidities and medications, and then they still want to talk about how they're feeling in the aging process, or everything that's going on, or like we mentioned before, things that need to be taken care of in the house.
Right.
Make it safer for them to live. And then, yes, I have that mid-range group of people that are in their 30s to 50s that are living a busy life, and it's hard for them to take off a day of work to come to the doctor's office, or they don't want to use a vacation day, or it's just busy. So, and I have people that travel. I have a lot of travel nurses that this has been great for.
Oh, that makes sense.
And then they have to go on assignments for 3 months, and they need to get cared for too. And people that work in the hospital work 12, 14-hour shifts, and it's hard for them to see anybody during that time. And then they're exhausted, especially if they work nights. Then they're trying to spend it on everything. So that has been great.
Mm-hmm. We're going to take a quick commercial break. Kristen will be right back. Okay. Thanks.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back into our show. We have Kristen Beauchesne, who is a ARNP, Advanced Registered Nurse Practitioner at Daisy Holistic Healthcare, and her number is 561-797-4055, and the website is www.daisyholisticcare.com, and you can also email Kristen, Kristen, at daisyholisticcare.com. Thanks for coming back to the show. I like how it's called Daisy. Where'd you come up with the name, the Daisy Holistic Care? What is that?
Daisy is my favorite flower, but also I had a Jack Russell named Daisy for my first dog that was just mine. So that's where it came from.
Oh, I love that. I love daisies. That's why I had to ask, because I love daisies also. That's why. Oh, and you had a Jack Russell named Daisy. That's so sweet.
Yeah. So remember, it's in the holistic care because I have the massage therapy as well that I still have, and like I said, that Sapphire plan offers people for me to. They have access to those visits. They still have to pay for them, but I'll come to the home and work on people in their home. Deep tissue massage therapy or stretch therapy. And being in massage therapy, and I always kept it going. I worked at a holistic health institute for many years, and I learned a lot of different holistic regimens. And I offer that to patients that choose that as their healthcare plans as well. We work together with that. I do a lot of vitamin panels, hormonal panels, and work with people on that naturopathic track if that's what their health goals are surrounded with.
I will say, Kristen, you're by far the most unique full service house call family medicine, because you're doing the massage. You're really you're able to offer them that, and there's so many different services that you offer. I know you mentioned previously about getting to the root cause of certain challenges, and I'm all about learning the root cause. Let's not just put a medicine on it. Let's figure out what the root cause is. So can you share with us any success stories of pe certain things that you were able to help a patient maybe overcome a challenge, or any type of blood profile that you were able to analyze something and see what, helped them?
Well, a lot of things, multiple people actually have a lot of vitamin deficiencies that they're unaware of. And so doing the panel on just finding the vitamin deficiencies and replacement of that, or working with the gut microbiome and helping them fix their GI system has, I can't count how many success stories over years of practicing that has helped. And also when it comes to depression and anxiety, finding out what the source was and going back to that and getting them to the right person to help them also talk with. But if there is medication that's needed, if there isn't medication that's needed, like helping them find ways that they can help heal themselves. And because it's a lifelong process. It's, if something happened and we just kept burying it, it takes a while to kind of find out where it started and then start from that and heal. So there's plenty of stories I can share. It's hard to go into.
That's okay. I just thought maybe if one. I just thought maybe if one in particular. But, getting back to what you were mentioning, the gut microbiome, they have had so much research and so much uncovering of exactly what the gut microbiome, and we're still learning, right, of how it affects us. And it's so amazing how our gut microbiome will affect our mental health, right? And like you said, depression, anxiety, our serotonin is created in our gut microbiome. Is that right?
Yep. Yeah. Mm-hmm. So it has a lot to do with that and eating and a lot of people depressing acid when sometimes that could be doing something else in there. So it's really kind of finding out sleep. Sleep has a lot to do with people on so many levels, with their being able to function, their moods, how they eat, their cortisol levels, all of that is a big thing. I have a lot of people I work with weight loss management. I have a lot of success stories with people that, had very high BMIs, 60, and now their BMI is, I know that sounds very high, but now getting closer to the 40s, getting closer to, will they ever be in that range where they're not in the obese range? But just at least having that 20-point reduction in their BMI is huge. And now they can walk and breathe and work out and sleep and breathe when they're sleeping, not having as much sleep apnea issues. Let's see.
That's a huge, sleep is huge, if people are having trouble sleeping and, challenges with that, that's I know for me personally, that affects my whole day. So for you being able to do the labs and test and see, maybe you're able to tweak certain things and figure out maybe why they're not sleeping.
Right. That's a big thing, but also just a lot of it has to do with certain things in life, and then just people putting themselves as a priority, which it's hard for all of them to do. But this type of practice, I feel, actually gives people encouragement to want to do that a little bit more, because sometimes they've never felt like somebody stopped and actually gave them their time to help them take care of themselves, explained it all, or what could be, or be that coach on the sideline, just like texting and calling. Other success stories is where hemoglobin A1C might have been like in the 13 range. Somebody didn't even know they were diabetic, but they were having problems peeing all night long. They weren't seeing correctly. Wow. They weren't thinking correctly, and it wasn't all clicking. And helping them get their A1C down to 7, from 13. Within like a 6-month period, and without, of course you have to add on medication, but then they work towards the goal of getting off of it.
Nice.
And so, and then just being cognizant of their diet from now on. So learning how to make meals and learning about what makes their glucose go up, or about not skipping meals, or their family history.
Right.
I think.
Sometimes that could be the biggest blessing, though, because, for me, I'll speak for myself, maybe having a challenge like that, it really puts in the forefront to prioritize my health. And it's kind of a wake up call, to be able to make better choices, right? A lot of it has to do with our lifestyle choices, right?
Yeah, I mean, I don't want to put too much out there of somebody's personal information, even though I'm
No,
not telling you
not at
names.
all. Not at all. But I'm just trying to get ideas of maybe.
Yeah, but another diabetic, a woman that had no idea that she was diabetic, and she was wondering why her tongue was white and why she had these rashes that kept happening, like
Wow.
underneath her or anywhere, and it was candida and a candida overgrowth. And when you're diabetic and your
Yeah.
body is not processing all of that, and she was getting these raging yeast infections and couldn't be intimate for over a couple of years, with her partner. And
Wow.
it was shit. Yeah, but some people have been traumatized by doctor's offices too.
Of course.
The
Of course.
or just the whole process. So this part, talking about those details, is such a nice setting for somebody just to be able to be completely open and honest.
Yes,
and really get better.
absolutely. I think it's easier to open up in your own home because you're already comfortable there, It's your own setting. So believe it or not, that it's already been a half hour, and the interview is we're coming to a close. So any last? We have like 30 seconds left, actually. If you want to share anything in the last 30 seconds.
Well, I just, if you are curious to know if this is your fit, you can call me for a consult. We could talk about the plans and what your health goals are and see if it's a match. But I'm here to help anybody that would like to give me a call.
Thank you so much. I will give your number out again, 561-797-4055, and that is daisyholisticcare.com. Thank you, Kristen. We appreciate you coming to the show and taking time out of your busy schedule. Thanks so much.
Thank you.
Okay. Bye-bye. I think